warm welcome to you. My name is Diana Arias with the Community Technical Assistance Center at NYU's McSilver Institute. And I want to welcome you to our Mental Health Moments series, which is an educational series in which we gain insights from speakers with an expertise on critical issues surrounding the child and adolescent behavioral health field. Today, we are very excited and honored to have Dr. Cindy Leung for a conversation about food insecurity as a source of toxic stress in youth. So before we get started, I just want to provide a little bit of level setting information. Clearly, all of you who have joined are aware or curious about the relationship between food insecurity and mental health. So again, just wanted to provide a little bit of information so we're all on the same page. What we do know is that the conditions in which we exist do impact our overall well-being. And in thinking about food insecurity, I just wanted to share the formal definition from the USDA, which is the limited or uncertain ability of nutritionally adequate and safe foods, or the limited or uncertain ability to acquire foods in socially acceptable ways. So the most recent data that we have from 2023 highlights the prevalence of food insecurity. So what we see here is that in 2023, there was about 1 in 7 households that were classified as food insecure. Looking at the numbers, we do see that children, just over 13 million children lived in food insecure households in the US in 2023. And we also see that there is a high rate for single parent households, primarily headed by women, also experiencing food insecurity. And when we look at things, at other household characteristics and identities, what we do also notice is that there is disproportionate rates of food insecurity. So for households that identified as either Black or Latinx, they were experiencing higher rates of food insecurity. For Black households, 23%, and for Latinx, 21%, in comparison to just the overall national rate of 13.5%, and obviously also experiencing food insecurity at higher rates for white non-Latinx households. So I think here just really wanting to highlight the fact that there are certain communities, certain groups that are experiencing food insecurity at higher rates. And these might be some of the people that you are working with, again, whether it's in the shelter system, as some of you mentioned, or in other sites and programs. So what's the connection to food insecurity and mental health? Well, we do have some information that caregivers and children living in food insecure households may experience some of these following mental health challenges: depression and anxiety, either externalizing or internalizing behavior, so maybe lashing out, acting out, or maybe withdrawing, hyperactivity, or stress. So that is a very quick introduction into a larger conversation that we're going to have today. So with that, I do want to turn it over to my colleague, Dr. Cara Sale, who will be speaking with our invited guest, Dr. Cindy Leung. Dr. Cindy Leung is an associate professor of public health, nutrition at Harvard, and a lot of her work really does focus on understanding the health impacts of food insecurity and the underlying mechanisms across the lifespan. So with that, welcome all again to our Mental Health Moment, a conversation about food insecurity as a source of toxic stress. And I'm going to turn it over to my colleague.
Thank you, Diana. And welcome, everyone. I'm really honored to be here in the company of Dr. Cindy Leung, as well as Diana and Felicia and all of you. This is a really important conversation. We're going to share some hard things that you already know, but also just really good information to continue to think about as you provide quality services to youth and families. So I get emotional just thinking about this topic because it's so huge and so important and not very well attended to. So Dr. Leung, please introduce yourself to us and tell us how you got into this work.
Hi, everyone. Before I introduce myself, I just wanted to say a thank you to Diana and Cara for the invitation to speak at today's mental health moment. And I also want to thank you all for joining. Thank you for your interest in food insecurity and the work that you're already doing in your communities. I'm really honored to be here with everyone. So as Cara mentioned, I am a nutrition epidemiologist by training. Most of my research focuses on the impacts of food insecurity on various health outcomes across the life course. So I've studied groups like children and their caregivers, I have a larger group of projects focused on college students. And I also have some ongoing studies on older adults. And so I study these different age groups and the health outcomes that are most relevant to where they are age or developmentally. Another arm of my work also focuses on how do we use evidence-based strategies to support our federal nutrition policies so that we can better alleviate food insecurity and promote health equity, particularly in structurally marginalized populations. So I have been studying food insecurity for almost 20 years. I first got into this work when I was between graduate programs, and as a MPH graduate in nutrition who didn't have a registered dietitian degree, there were not a lot of employment opportunities in the community. And I really want to do something with nutrition and nutrition education. So the first job that I ever got after I graduated was being a nutrition education intern at a large food bank in Oakland, California. I ended up in that position for a few months, and then I became their agency and nutrition services coordinator. So I worked at this food bank for over a year, and it was one of the most incredible experiences because I got to work alongside these really dedicated anti-hunger advocates and people who just did all this work to feed our communities. It's where I became really passionate about solving food insecurity. My first day on the job, my executive director at the food bank told us that she imagined a day where we would all be out of work because we wouldn't need food banks anymore in this country. But since then, we've seen my old food bank and food banks across the country, their caseload has continued to skyrocket. So it's obviously, food banks and other charitable food organizations are not going away. I work daily with our clients, food bank clients, and taught them how to cook foods that came through our warehouse and taught them how to shop on a budget and how to read nutrition facts labels, and just saw all of these barriers to healthy eating if you are food insecure or you're living in a low income or low resource area. I also saw a lot of people who had things like diabetes and hypertension, and every single client I met with said that they wanted to eat better, not just for them, but also for their children. And so I became really passionate about trying to figure out how are we solving food insecurity in our country and how do we improve those programs or policies. That's where I've been working ever since. And I'm happy to share any of my experiences with you all if that would be helpful.
Beautiful. Thank you so much for that introduction and for just kind of giving us the context of our conversation today, because you've had such a varied experience. So you're not a mental health provider necessarily, but through this work, you have a sense of mental health challenges and as in relation to food insecurity. And so I think that's a really important place to start. You wrote an incredible article. I think we sent it in the announcement, and maybe we could put it in the chat with some colleagues of yours. It was published in 2020, where you looked at interviewing kids ages 7 to 14 around their experiences with food insecurity and hunger. And so I'm curious about kind of that. Why did you write that article? Why did you do that research? So the research was you had 48 families and 60 youth altogether. And so I'm curious about what made you even kind of embark into this study. And we're going to talk a little bit about the study, but we are going to broaden it, everyone, to kind of the lives of young people and the stress that they experience around hunger. But I also am just talking to the audience for a second. So please chat in any questions along the way as well, because this is a conversation that obviously I'm having with Dr. Leung, but we want to open it up to everybody as well, because it's a really important conversation. But I just want to start there around the article that I believe somebody just put in the chat. Thank you. Around your qualitative interviews with young people.
I will never forget that study. It took us probably a good year to conduct all of these interviews. But every interview, every household that welcomed us into their home was just so powerful and eye-opening, even for me as someone who had been studying food insecurity for a while. So I'll give some context. When we embarked on that study, we were inspired by a few other qualitative studies about food insecurity in children and adolescents that had come before. For a long time, and I think there is still some perceptions around this, children are protected in food insecure households because parents will go to whatever extent that they need to make sure that their children are fed. And so we know parents are well-intentioned. We know parents will eat less so their children can eat. But they might eat different foods. They might not even eat at all. Sometimes parents don't talk about it. They'll say, I'm on a diet, so you guys eat. Don't worry about it. They'll send their kids off to other friends' houses, other relatives to get food. And so there was, even when we assess food insecurity at the household level, we always ask the primary caregiver. We never ask the children because we just assume children don't know and they're protected. They're shielded from food insecurity. And there were studies that were coming out that were showing that maybe wasn't the case. In 2011, there was a study that came out in the Journal of Nutrition by Mariah Fram and colleagues, and she's at the University of South Carolina. They interviewed families in South Carolina who were at risk for food insecurity. And they showed that children, I think their age range was 9 to 16, so a little older than our study. But children 9 and up displayed different forms of awareness around food insecurity. So they had cognitive awareness, they had emotional awareness, like meaning that they were maybe worried about their parents who were, working hard to get them food. They had physical awareness. So, they know that they're hungry because there's not enough food in the household. And there were coping strategies that children and those families exhibited that the parents didn't even know about. And so when we wanted to conduct our study, we wanted to first kind of validate their paper and show that this wasn't just something about South Carolina and the families that were in their study, but maybe this is the phenomenon that stretches across many families who experience food insecurity with children in that age range. And we wanted to delve into the stress of food insecurity. So we went into this calling it stress because we know that families worry about food. That's one of the earliest indicators that a family might become food insecure. They worry that their food's going to run out before they have more money to buy more. That's the first question that's asked in the USDA Food Security Survey module. So we know that that's the element that comes first, the psychological component. So when we embarked on the study, we interviewed parents or caregivers and their children separately, but simultaneously. And we asked them each questions that were tailored to their age group about whether they were aware of food insecurity and how they felt about it. We drew from published research on how we thought different emotions might come up with respect to food insecurity. And then we asked how they coped with it. And we started out, I think, with 8 to 14. And then we actually had parents who had younger children, 7-year-olds, who really wanted to participate. And so we actually submitted an IRB amendment to bring down our age range so that we could interview younger children. And we were really, surprised at how eloquently 7 and 8-year-olds could talk about food insecurity. They didn't call it food insecurity, but they were certainly aware. They were aware of food insecurity, just like the families in the South Carolina study. So, we might have children saying like, my parents, sometimes they don't eat anything. They don't say it, but we just notice that they don't eat. Or they'll eat my leftovers and that's all they'll eat. So they're noticing the eating patterns or the eating behaviors of their parent. We've had children tell us that like they notice that their parents only eat cereal in the morning, but the kids get the nicer food. They get to eat the eggs and the bacon. And so there's a difference in quality that kids are picking up on. And then kids were also really knowledgeable about the different kinds of resources that their family used. So they knew when their SNAP benefits were coming in. They knew that they qualified for free or reduced lunch, and that's why they had that's why they got lunch at school every day. We had one family who at the time was unhoused, living in their car, and their child was telling us about this GoFundMe page that their parents had put up to try to get people to donate so that they would have money to stay at a motel or to buy food. So kids were very knowledgeable about these things. They knew they couldn't buy certain foods at the grocery store. They knew they had to wait for their SNAP benefits to come in. They knew that there were just like things that were out of reach for their family with respect to food. After we established that initial kind of baseline awareness, we then tried to ask them how they felt about food insecurity. And most of the children in our study told us that they worried. They worried about whether they were going to have food to eat. Sometimes they said they worried that they're about their parents, that they didn't look well. They were always tired because they were working such long hours to make sure they had food. And that was just a really prominent theme that came up from children of varying ages, from 7 to 14. When we started asking about other emotions, is when we heard things like we heard children talk about feeling embarrassed, feeling ashamed that their families were food insecure. We heard them talk about not wanting to share this with their parents. We heard children talk about feeling sad or depressed that they didn't have the food that they want to eat all the time. We heard children said that like their friends made fun of them because they didn't have the right food that they brought to school, to the point where their teacher had to tell them to stop. And so it wasn't just like, we don't have enough calories or we don't get to eat the food that we want. There were a lot of emotional responses that came up because their family was food insecure. I don't know if this is a good time to share some of the quotes, but we do in the paper. Yeah.
Thank you. You read my mind. Yes. I'm going to be sharing my screen to share. So I would like some of the voices of the young people to be with us in here. Just give me 1 second. Here are some of the direct quotes from your study that I think is a good time to talk about and share. So you have 2 here, one about shame and one about sadness.
And these were both from 13-year-olds in the study, but they were not the only ones who talked about this. And when I interviewed for the first child, the parent in their interview with me said she won't even have her friends come over. So it was kind of this reinforcing family dynamic that they all knew their child was embarrassed about their food situation, and it was keeping her from bringing her friends over to the house. So it is really eye-opening to hear these words come out of the mouths of such young people we think wouldn't necessarily know the extent of food insecurity in their household. But I think what I learned from doing the study is that I don't think we give children enough credit. They really are, they're paying attention, they're watching what their parents are doing, and even at young ages, they're trying to think about how I can help the family. So we had another young boy who was talking about learning guitar so he could go and busk on the street so that he could also try to bring home some money for the food budget. So there definitely was a lot of elements of psychological distress. We broadened the term. We're not calling it just stress anymore, because stress, I think, is a very specific emotion. But when we think about all these other things that go along with worrying about food running out, it seemed like distress was the more appropriate term at the time. And then if you want to go to the next slide, when we asked about coping strategies, we heard also, some people said that some of the kids said that they tried to distract themselves, they did homework, they watched TV, they listened to music, they played video games, like they do things just to not think about it. Another child said, it's just there. I try not to think about it anymore. But the one child that really stuck out to me was he said, I have an imaginary friend. He's the one who gives me the imaginary food because he works at a place where you could eat any food you want. I just imagine I have food. I imagine I have food and then I eat the imaginary food. A 7-year-old. I still have trouble reading that quote and not, feeling emotional because as a parent, I could never imagine my 7-year-old saying words like that. And the way they said it was, this is what it is. And I try to make the best out of what we have. And then we also heard some appreciation for their parents. Um, 10-year-old said, I don't care if I don't eat for a day. If I didn't eat for a week, then that's when I would start saying stuff. But 2, 3 days is fine. We've been in rough times, but it's okay. If it wasn't for my mom saving up food, I wouldn't be here. I'd probably be in a grave. This was a mother and son who had just moved into a new apartment. She had left an abusive relationship. They were previously homeless and living in a shelter, so they had just found stable housing, and that's the time that they came into the study. And so he definitely, when he says we've been in rough times, I think he truly has, and was really appreciative of this mom at that point.
Yeah, thank you. I want to just go back a little bit about your concept of psychological distress, because you make a point in your article saying we didn't want to just focus on distress. So it wasn't like behavioral or otherwise distress. It was actual psychological distress. And that was the whole point of this study in some ways. And you can see that as I was reading it, and it's not new. I've worked with young people who didn't know where their next meal was going to come from. I worked with some people in DC who studied adolescence and the behaviors and the feelings that they would experience as a result. And so, but talk to me a little bit, talk to us. Sorry, this is collaborative discussion. Talk to us about your framing of psychological distress, because I think that's one of the big takeaways for today, everyone, is really thinking about the impact of food insecurity and where we come in as mental health providers. So,
Yeah.
just a little bit about that.
Well, fun fact is in that paper, we actually tried to call it toxic stress. And I guess in 2020, the idea that food insecurity could be so severe that it could trigger a toxic stress response was too wild at the time. And we were asked to change our terminology. So we called it psychological distress. We wanted to just find a broader term that encompassed the range of emotions that we heard from all of the interviews with the children and their parents. Stress kind of being the core element, this kind of worry or anxiety about food running out, but then all the other layers that come from it. And the parent interviews were published in a separate paper. But from the parent interviews, we heard similar things. We heard, feeling ashamed that they couldn't provide for their family, feeling ashamed that they had to stand in a food pantry line and wearing a disguise so people wouldn't see them, hiding their EBT card in their hand or in their sleeve when they swipe it so people don't, try to scrutinize what they're buying. Or, we heard elements of just anger and frustration of like, why is all the food that I can afford so heavily processed and full of all these like additives and things that I don't want to be feeding my kids, but then I don't have any choice. Like why am I feeding my kids sugary cereal that costs $1 a box? Why can't I buy the nicer cereal that costs $4 or $5 a box? And there is this, this feeling of feeling like they were being punished because they just couldn't afford basic necessities for their family. So similar to the children's interviews, we heard kind of elements of sadness, shame, feeling isolated. We heard the same from their parents, but in a slightly different context. But it just showed that food insecurity has such a broad psychological range of consequences. That's not just, I worry that my food is going to run out. And because that's the only indicator that we measure nationally in the USDA survey module, That's the only thing that we're capturing. And everything else in our module is focused on, did you eat less? Did you cut the size of your meals? Did you lose weight because there wasn't enough money for food? So all the other questions are focused on the quantity and the quality of the foods that you eat. We know those are affected too, there's no question. But there's just not enough people thinking about the psychological impacts of food insecurity. And I come from this as a nutrition epidemiologist. So I've done all the studies showing that food insecurity leads to poor dietary intake and higher intake of ultra processed foods and lower intakes of fruits and vegetables. I've done all of that. And then when you try to figure out why is food insecurity being associated with poor diet? Well, you can point to the food environment. Like you can definitely say there's food deserts, that healthy food is more expensive, that SNAP benefits aren't enough. There's all these kind of environmental reasons why. But at the same time, a lot of, the household then purchases the food gets distributed to the individual. The individual is the one who manifests the health behavior, the health outcomes. For children, there's not a lot of physical health outcomes, not nearly as much as adults, I should say. But for adults, the literature is so robust that food insecurity predicts a myriad of health outcomes. It predicts more smoking, more alcohol abuse, more illicit drug use, poor diet quality, worse sleep, more metabolic syndrome, more inflammation, higher risk of diabetes. Like the list goes on and on for physical health outcomes. And so when you're trying to figure out why is this happening? You can say poor diet. That could be one of the reasons. But then I should add, after I did my doctoral training in nutrition and epidemiology, I did a 5-year postdoc in health psychology. And my postdoc mentor was a health psychologist who studies the stress of caregiving and the burden that caregivers have for a loved one who has dementia, for example, and why caregivers themselves are at a higher risk of certain diseases. And stress is the main part. So when I brought in kind of my interest and expertise in food insecurity, we start to think maybe food insecurity acts through a similar pathway. Maybe there's a stress component. We know stress changes how we eat, like the foods that we want to eat, how we make decisions about our food. And then if you pair that with just such a toxic food environment, it's no wonder we're seeing poor diet quality for people who are food insecure. And so that's kind of why we start to think about this stress piece almost in equal weight as the dietary piece and the fact that they interact with each other. Stress affects diet and diet affects stress. And both of those manifest in the same individual with food insecurity. So that's kind of why we want to write the piece that food insecurity is a source of toxic stress. Because we just want it to be very clear. Food insecurity is easy to ignore. It's persisted in this country ever since we've been measuring it. But, there are certain stressors for young children that we think are urgent to intervene on. Yeah. Physical abuse, extreme poverty. There's policies. There's a lot of attention on certain things to make sure children have the right resources to grow. Well, food insecurity is just kind of ignored. And so we thought maybe if we shift our focus and we say food insecurity acts as a toxic stressor, which it does, it meets all the criteria of toxic stress, maybe we can change the way that we address food insecurity in this country.
Yeah, we agreed. And I am reminded that you do come from this work from like a nutrition standpoint, which is interesting because I've had many conversations. So I received my doctorate in 2020, clinical social work, and my focus was looking at food insecurity and mental health. Your study hadn't come out yet, otherwise you would have been a big part of my dissertation. But so much that I researched and conversed with people, and there's this kind of there's this conversation in the field, right? That it's like nutrition has the conversation around, well, people do need to eat better quality. It's like there's even this program called Carrots Yes, and all these financial assistance into these programs around nutrition education. And then there are some of us that are like, no, people know what to eat. They actually can't afford it. They often can't access it. They're culturally relevant foods. People move from other countries and can't find the foods that they are used to eating and want to eat for their own nutrition. I mean, there's so many compounded issues where I would call it the multiple ingredients of food insecurity, right? That there's so many different pieces to it. And Diane and I also conducted a study around looking at ACEs, child adversity, and caregivers, and the impact of adversity in the young people and that relationship between caregiver adversity and the young person's adversity in food pantries. And so it was really interesting to really look at that. We hope to expand that one day, but I think this conversation is really important, and some of you are chatting in as such, so thank you. Someone says, I remember walking in and seeing locks on the refrigerator limiting access to food. And then somebody says, this is one of the reasons I feed every child that comes to my home and every time I can in the community, because you never know what people are experiencing. And then some people are saying, reminds me when I was younger, a great study to raise awareness. Somebody does have a question. I think we could pop in with a question right now. How often should we assess or reassess children, and the adult to know if they are facing these issues? Because look what took right. So there is this kind of backdrop of, so this was your study in 2020 release, so it was done prior. And so we know since then there have been a lot of big stressors in young people's lives, right? And so I kind of was reading your art. I read it many years ago, but rereading it now in the context of SNAP benefits being halted for many people, and thinking about the levels of stress now, right? So thank you for that question. I think one of the resources we wanted to share is a 2-item screen. I'm going to bring that up right now, if that's okay, for people to kind of look at. Let me see here. And it was shared in the chat, by the way. I'm just going to bring it up again. And this is something that you could easily do really quickly when you're working with young people. So I don't know, Felicia, if you can share this again, but these are 2 questions. So within the past 12 months, we worried whether our food would run out before we got money to buy more. This is what you were talking about. This is actually the first question on the questionnaire. The questionnaire actually
Yes,
had 12 questions. And within the past 12 months, the food we bought just didn't last, and we didn't have money to get more. So the way you answer that question is often true or sometimes true. And so
or never true.
Never true.
Right.
And so, if people are answering often true, we need to think about other resources, right? Or sometimes true, we need to think about other resources. And so these are questions to the I'm sorry, I'm not remembering your name, but you, because the chat changed, you asked how should we reassess. My recommendation would be, often when you have concerns or you want to understand kind of people's lived experiences and the other factors contributing to mental health challenges, right? I don't know, Dr. Leung, what would you say? Anything to add to that?
So I think the clinical recommendation is to administer the hunger vital sign at least once a year. And I know large healthcare systems will do this annually with their primary care patients, for example, like once a year during your annual health maintenance exam, your physical, you complete this social determinants of health questionnaire, and they often include the 2-item hunger vital sign. The hunger vital sign was developed out of pediatric researchers. So this is developed for families with children with high sensitivity and high specificity. It has since been validated for use for adults too, to screen for food insecurity. But a positive screen, which would be an affirmative response, often or sometimes true to either one of these questions, is enough to trigger some next step. And I think we have to be clear on what would that next step look like? We don't, every healthcare system and lots of people are trying to figure that out right now. What do you do when screening is great, that's the first part, but then what do you do when you have a positive screen? What is the next stage? I think so a lot of my work on this has been in a primary care healthcare setting, and patients say they really appreciate when their healthcare providers can talk with them about this. So they want to have that trust with their healthcare provider, and they want that their social needs to be part of their care process. There is no magic answer for what do you do after you have a positive screen for food insecurity. Sometimes there's a trained social worker on staff, and that person can connect with the patient, refer them to food pantries and their zip code, connect them with SNAP application assistance. It's not easy because oftentimes patients come from a wide geographic area and they usually already know what's available in their neighborhood. So they're trying to figure out what's new what new information they can receive. But I think, having a list of local charitable food providers on hand is helpful, trying to make sure that people know all of the assistance programs that they're eligible for, SNAP being a major one, but also, if it's a child, are they getting free or reduced school lunch? If their state does not yet have a universal school meals policy, are there other like monetary forms of social assistance that their family might qualify for? And so I think there's sometimes patients have suggested opening a food pantry on site, that after that they screen positive, they can go and shop at the food pantry, having a local farmers market come, or just having some awareness that there is more to what is going on in someone's life than what presents on their health record. So I think a lot of times, like, people are trying to figure out what is the best solution for my patients and how do we implement this. There's no magic solution, but I think this interest in food as medicine and trying to address patients both like social and health needs is a really great start to try to figure out where do healthcare systems play.
Thank you. Yeah. And I think the sentiment around people trusting their healthcare provider and share this information and how important that is for their health. I think the same is true for mental health, right? And somebody put in the chat around the social determinants of health screening would be helpful, which also covers food insecurity. So if you all have the social determinants of health screening, if you have, Evan, thank you, Evan. If you have that and you want to put it in the chat, or I don't know if people can chat links. I think you can. Please share that. We have a few of those somewhere we can also send around. And then somebody has a question about, I'm curious about the long-term impact of food insecurity on kids, even after children are no longer food insecure. I'm a CASA volunteer. One of my cases is a sibling group that has been in foster care for 4 years. Since removal from their parents, they have plenty of access to nutritious food, but the impact still seems to be very powerful, for sure. Yes. Yeah. There's a lot of research out there that would absolutely agree with that connection. Dr. Leung, do you want to speak about that?
Yeah, that's a really great question. There are a couple studies that have looked long term, followed the same child or family over many years. Food insecurity is a little trickier because many of our studies. Okay, sorry. So let me go back to the beginning. We have a few studies that have followed children across childhood, like kindergarten through high school graduation. I think those studies actually end after they reach adulthood. So we don't have a ton of studies yet to look at what happens as they enter adulthood and become financially independent and finish their schooling and so forth. We have studies on college food insecurity and what happens after. So part of this is work that I did in the panel study of income dynamics, which is it's the oldest and longest running household panel survey in the United States. It's a very economics heavy survey, so there's not a lot of health measures. But we were able to look at what happens if someone's food insecure during the years they're enrolled in college, and then look prospectively to see what does their early to mid adulthood look like. And we found that people who were food insecure in college went on to have lower educational attainment, so they were less likely to finish school. We found that they were more likely to report food insecurity 15 years into adulthood. they had a noticeable gap in their wealth compared to their food secure college peers. They had lower levels of employment. And so there's definitely an economic consequence of experiencing food insecurity during college. Now, college is also an unusual time because some people come into college and they experience food insecurity for the first time because now they have to learn how to navigate a new food environment. They may not have a car. They don't know how to shop or cook. Like they're learning all these life skills at the same time. So some people find themselves food insecure in college for those reasons. And then there's other people who find themselves food insecure, but they were also food insecure in high school and in their childhood years. And so this is just part of their family's socioeconomic circumstance. And they're now, again, food insecure in college because maybe they get financial aid and that doesn't cover the full cost of college and they don't have a lot of extra money to be spending on food. So at least we know from like studies like that there are certainly socioeconomic consequences of food insecurity. We've also seen that food insecurity has this intergenerational transmission. So people who report that they were food insecure during childhood are also more likely to their children are more likely to report food insecurity in their childhood. So there is this cyclical nature of food insecurity and SNAP participation because that goes right alongside it. We've done some qualitative work where we've asked young adults to kind of like look back and think if they, didn't necessarily have all the foods that they wanted to eat when they were in early elementary school, and then could kind of think if that had an impact on their eating behaviors now. And interestingly, we heard youth talk about how sometimes that makes them eat more now because they want to make sure that they have enough now when previously they didn't, and that really shaped how they eat. And then others who said like, well, now I'm just used to eating less, so I just don't eat a lot. So we heard a dichotomy there. This was a doctoral dissertation project that's still, we're trying to publish it. But it's hard to understand kind of the long-term effects of food insecurity because oftentimes our data sets just don't have that really long, like decades of follow-up. And if we look to our kind of existing studies, most of them don't measure food insecurity repeatedly across someone's childhood and then like later on into adulthood. So we're definitely trying to figure out all the resources at our disposal to try to answer these really important questions. But I also think we need to have a better retrospective measure where we can have, say, someone look back in their childhood and think like, did I always have the food that I want to eat? Or was it sometimes maybe not enough, not the right kinds of foods that I wanted, or some sort of indicator that would allow us to then connect it to their individual behaviors in the present, and then look prospectively at various sorts of chronic disease outcomes to see is there some link between past recollection of food insecurity, like we have with ACEs, and how that influences adult health outcomes down the road.
Thank you so much. Thank you so much. There are a lot of questions. I want to just kind of conclude this section because I think it's really poignant that you say in your article, you and your colleagues, collectively, the psychological distress associated with food insecurity may constitute a form of chronic social adversity that can directly influence children's development and health. And I would go so far as to add mental health. And I think that's what you're saying, right? Like are there long-term mental health consequences when experiencing food insecurity? For sure. And that's why another reason we're having this conversation today. But I was left thinking about like some of those young people. This is 6 years later. 13-year-old is now 19 years old and wonder how they're coping and what their situations look like and if they're still experiencing food insecurity and all of that. So thank you for that question, whoever asked it. So I do want to kind of turn to, please chat in your questions. I'm going to look at the chat again. What resources or course of action should people be trained on or have available to provide the child and family? That's a great question. So, I mean, I think a few things. I think, and of course, Dr. Leung, I think you touched upon some of these. So any other thoughts that come in, please talk. So there are a multiple relationships. So we often call it a bi-directional relationship between like food insecurity and depression or anxiety, right? Or even ADHD. There's this kind of bi-directional relationship. And so I think step one is just educating yourself around that and understanding that and asking those questions when you're meeting with people to get a really holistic understanding of their day-to-day struggles, right? So if you have a young person coming in with because they can't sit in their seat in school, for example, you may want to ask about what's their diet like. Do you ever have trouble getting enough food for your young child to eat? And really normalizing that this is a real challenge for so many people, 40 some million people in our country, right, experiencing food insecurity. And so I think starting there could be really helpful. And also that social determinants of health screening could be really helpful as well. And then what do you do about it, right? Well, there is this movement called mutual aid that I just want to put out there that I think is incredibly important, where it's really communities caring for each other. And so there are free refrigerators that are out in the open. There's actually like 20 some in New York City alone. And I know they're all throughout New York State. There's one in Kingston, there's one in Beacon, New York, where I live. They're all throughout the state of New York, I'm sure. And if not, maybe you could start one. But I think having really like participating in mutual aid experiences, whether it's a community dinner once a week, that's something that my colleagues are doing here in my town, or whatever we can do for each other at this point, because as somebody mentioned, there is, this is a really challenging time, and there are even more stressors for people and children. We know from your study that children feel the effects of hunger in their families, right? And there have been other studies that have shown that as well. But the psychological distress piece is really why we wanted to talk today, because we just hope that stands out so that we can think about attending to this issue even more. There are clinics that have food pantries. I think that's incredible. And so we recommend more of that. And I don't know, Dr. Leung, do you have anything to add? Diana, do you have anything to add? I'm going to call on you, Diana.
I mean, if folks have the capacity to start a new food pantry, that would be incredible. I recognize that it is a ton of work to get a new food pantry off the ground. If you connect with your local food bank, that would be a really nice partnership to become a member agency, and then you can get food from your local food bank. You don't have to go to your local grocery store and see if you can get donations. You can get food directly from the food bank, and most food banks operate in this way. They're a kind of a middle ground for food from grocery stores or from kind of industry or farms, and then they give it out to their member agencies, which include soup kitchens, churches, food pantries, schools, and then the people on the ground then give it out to their community. So food pantries are a great option. We know that that's been brought up by our primary care patients as a solution that they would like to see. But I also just want to recognize that like food pantries are not going to solve the problem of food insecurity. I think it's a great immediate resource for people who are needing food. There's also websites where you can go to find your nearest food pantry. Findhelp.org is one that you can filter by where you are and whether you're looking for food or housing or transportation or whatever kind of basic need, and they'll provide a list of organizations that are providing that in the community. But I think longer term, we need to figure out how do we support our social safety net, because it's crumbling. SNAP has it's been extremely chaotic for people on the program starting in mid-October during the shutdown, and SNAP is our first line of defense against food insecurity. It is the program that we make sure everyone who's even at risk of food insecurity can access. And during COVID, we saw when we expanded SNAP and we increased benefits, we actually stabilized food insecurity during a global pandemic. And yet, like when all of those flexibilities went away in 2022 and 2023, that's when we saw food insecurity in the US go up. So food insecurity is very responsive to these factors. And if we expanded SNAP, or at least kept it at the status quo, it would really help to stabilize food insecurity now. But obviously, we're not seeing that. And in fact, there was a historic lapse in benefits that happened in November. There's new work requirements that were just implemented for families, particularly if there's older kids, 14 and up, which previously, if you were a SNAP eligible family with a 15-year-old, you did not have to meet the work requirements to continue to get SNAP benefits. Well, that's no longer the case. And so there's a lot of threats coming to SNAP. And I think everyone's role here as a healthcare provider, as someone who works with youth in a professional setting, we all have the right to advocate for the programs that we think will serve the people who come through our organizations. And so SNAP is just a really obvious policy that I think we should try to make sure we advocate for, at least like keeping the status quo. But then there's also what we've seen during the pandemic is all of our financial safety net policies. If we just provide people more money, it doesn't have to be through SNAP benefits to buy food, but just money in the form of housing assistance or stimulus payments or child tax credits, that reduced food insecurity during the pandemic. So I think sometimes we are so narrowly focused. I say this as a nutritionist, we're like, we need to solve food insecurity with food. So we need to give people money to buy food, or we need to give people bags of food. But food insecurity results because we have such structural inequities. And we're not going to food pantry our way out of that. We're not going to educate people out of that. I saw that firsthand. No matter how many workshops I delivered to my clients when I worked at the food bank, they were still going to be food insecure. So I think, we need to figure out kind of how do we address this immediately with our clients, but then how do we look long-term and make sure that our policies are protected so that people who need to use social assistance have the right to use them, have the right to get benefits, and stay on it as long as they need to.
Thank you.
So appreciate that, Cindy. Yeah. And as we work towards wrapping up here, right, there's so many comments. So again, thank you everyone who's participated. You mentioned the notion of food is medicine, right? So I'm also wondering, right, there's also this push to move past just focusing on food insecurity, but also nutrition insecurity, which is, I think, pulling in some of the things that you mentioned, right? We're moving away from just that individual household. What are some things that we can do at the community level, at the societal level, right? At these larger macro levels. So in the last minutes that we have, given your background, I'm wondering if you can add, or if you can share a little bit more about these health inequities and primarily how that does impact a lot of communities that have been historically marginalized and oppressed on so many different levels. But when it comes to food, we sometimes don't really focus that much on that. So don't know if there's anything else that you can share on that or your thoughts on that.
Yeah, I mean, we have such an imbalance in our food system, and it definitely gets magnified for structurally marginalized communities. And we see that with food insecurity in our national statistics, which, after this year's report, may be the last one, which as a researcher, we're very concerned about, because if we stop monitoring food insecurity, we won't know whether our policies are working, where to intervene, what groups might be most at risk. But I mean, this is a larger question than food insecurity. Our food system is very broken. And so how do we shift the power back to the farmers, back to families? When I was faculty at the University of Michigan in Ann Arbor, we worked closely with folks in Detroit. And in Detroit, there were a lot of urban farmers, people who were trying to promote food sovereignty and really use food as a means of taking back the land and their right to eat the nutritious food that is appropriate for their health needs, for their culture, for their families. And I would love to see movements like that be expanded nationally, because our food system is so centralized with a few players, and it is really unfair that they get to control what millions of Americans eat every day. It is such a luxury to be able to even buy organic food sometimes, or to buy brand name foods that you think are somewhat higher quality. And you know, it certainly overlaps with the concept of food insecurity and how do we address food insecurity. But I also just think there is a bigger movement here of trying to make sure everyone has access to healthy, nutritious, sustainable food. And that is not just a food insecurity problem.
Yeah. No, I absolutely appreciate that, right? If we're talking about access, how do we go and address historical issues of food deserts, food apartheid, livable wages, even childcare, right? Subsidizing childcare, all these other things that are so related to food insecurity, and that it more often than not lead to these trade-offs between what do I need to prioritize. So yeah, it's such a larger conversation. And I am mindful of the time. I think this went by very quickly.
I could talk to you all day.
Yeah, no, as we close out, I do want to share some of the resources. So we are going to have the presentation, the recording and the slides posted on our website, mcsilverta.org, within the next 3 to 5 business days. There are some resources here that were listed in the slides, but we also have additional resources either on our website. So feel free to look at those. And I was able to also just include some of the resources that you all were sharing, primarily the social determinants of health sort of tool. So that is also here in case you weren't able to open it up via the chat box. Just a thank you. A lot of these thank yous have been coming in through the chat box, Dr. Leung. So on behalf of us here at CTAC, I want to thank you for your presentation. Kara, in conversation for that, thank you so much. All the attendees here, and just such an important real conversation that we certainly all encourage you to have with folks that you are working with. Have these conversations with your colleagues as well. What can you do on the front line in your community? What can you do at larger organizational levels to maybe the partnering with food pantries or things along those lines, anything else that sort of takes us in that direction. So again, with that, I do want to say thank you to you all. And on behalf of CTAC, have a good rest of your day, everyone.